Hey, hey, hey. Hi. Okay, it is 12:02. How are you doing today? I am Dr. Ravin Milton. If you have never watched one of my episodes, this is RX Info on the go. I give you information about the things you never knew you need to know. And I say that different every single time, but it's okay. You get the point. I am here to share some information with you, and today's topic is probiotics. So, we're going to talk about probiotics. I know everybody has heard about, well, I would hope everybody has heard about probiotics at some point in time. They are pretty popular. You see one on every corner. And I just want to talk a little bit about what they are, why you would take them. I'm not going to get into what's the best one to take just yet because there's a lot of them. There are so many ones that are out there. But we're going to talk about what we can talk about today, and I just would like you to get something from it. So I'm going to ask you to like, tag, and share, please. If you would be so kind as to like, tag, and share someone you know that's having tummy issues, or they just were interested in probiotics and want to know a little bit more, then if you would like, tag, and share, I would appreciate it. Get the word out. And I'm going to go ahead and get started. So here we go. You know, um, sorry, happy Wednesday. Let me just say that. Happy Wednesday, because I don't think I said it. So I'm gonna go ahead and say it now. Happy Wednesday. I hope you're enjoying your Wednesday. And now I'm gonna get started. So probiotics. Probiotics are found in your GI tract in the gastrointestinal system. They are there naturally and as supplements. They are there to help metabolize food and to maintain intestinal health. So what does that mean? It helps you to break down your food and it helps the gut function the way that it's supposed to work. Now, they are found in some foods and then they are also found in supplements. So if you've ever heard of something like anything that's kind of like fermented, um, kombucha. I always say it wrong. That drink is kind of well known for as being for probiotics, but it's also in other foods. Um, Oddly enough, this source that I found did not give me a specific food list, but we know that I believe Active brand yogurt, they typically will advertise as having probiotics in their yogurt. Yogurt is typically the one food that is always suggested for probiotic source, and yet data, like the actual data, doesn't say that it helps, but huh, we'll have to ask people to give their testimonies on that because that's really how we find out how things work or not when it comes to things that are over the counter and food and you know those sources. We really just have to hear from people who have actually tried it and to see if they work. Anyway, so there are several different kinds, and when I say several different kinds, y'all, I'm gonna give you this list. I don't know if you can see this. I'm not going to um oops, sorry. I'm not going to actually name off all of these, but this entire sheet of paper, all of this is different types of probiotics. Now, these are the actual organisms in different products that are available. I'm just going to name a couple like Lactobacillus acidophilus. That is like one of the more common ones. In addition to that, brewer's yeast. And I hate saying that one because that comes out so funny. Brewers, brewers yeast. There we go. And this one is a tongue twister, but I'm going to say it anyway, is Bifidobacterium longum. Bifidobacterium longum. That is another one. There's so many that's out there. If I had to actually pull some more off of this list, some of them start with the lactose, some of them start with lacticase, some of them start with bacillus. It's literally, and there's even one that's called Streptococcus thermophilus. That's a whole bunch of technical names to y'all, but just know it's a probiotic that helps. And some of these things are in combination. Now, what are we going to use probiotics for? There's actually a long list. So here we go with the long list. Now, abdominal pain, that's going to be kind of the ones that, we know that it helps with, because probiotics are in the GI tract. So you would think that if you're having some type of abdominal pain, you do want to figure out where it's coming from, but also a lot of people go to the natural. Let's throw a probiotic on it and see if it helps. It does not hurt. So, let's try it out. The one thing that I do know that it is helpful for is to prevent or to help reduce antibiotic associated diarrhea. Now, as a pharmacist, over the years, I believe we have suggested a probiotic for just about every person that comes through with an antibiotic. And they just kind of go hand in hand at this point, because there are a lot of antibiotics that do cause diarrhea. Now, if you want to understand why they cause diarrhea, let me just say this. Antibiotics wipe out all your good bacteria and your bad bacteria in your gut. Please know that we have good bacteria in the body, good bacteria that helps the body out, and they are in the gut. Now, when you remove that good bacteria, it throws everything off balance and you end up having diarrhea. That's where probiotics come in. Probiotics will help to put back the good bacteria, because all of these things that I just named off, they are bacteria. They help to put back the good bacteria in your system so that it can balance out what was taken out by the antibiotics, and then restore that gut health so that you do not have diarrhea any longer. Now, I will say, that 9 times out of 10 that it does help with that. And if it doesn't have help with that, then most of the time it's going to be just because it's a very strong antibiotic that, kind of will cause the diarrhea anyway. So, antibiotic associated diarrhea, just make sure if you are taking an antibiotic, please go ahead and get you a probiotic on the side. If your pharmacist does not suggest one, or your physician doesn't suggest one, please go ahead and get one anyway. It will be helpful, not harmful in the long run. Now, another one that surprised me, but I mean, there's a lot of things that I find out when I'm doing these studies, because, I've been doing this for about over 20 years. So we forget a little bit of the little things that we learn along the way. Probiotics can actually help with eczema, and not in the form of treating eczema, but helping to prevent eczema. So I'm not quite sure how that works, but it does work. And another one that I do know is bacterial vaginosis. Now, bacterial vaginosis, we call it BV. It is a vaginal pH imbalance, pretty much. And probiotics there's oral probiotics and there's vaginal probiotics. Vaginal probiotics, as well as oral probiotics, can help to restore that pH balance, and therefore, lessen the ability of having a bacterial vaginosis on hand. That's just one of those things that we actually know. So, like right along with the oral antibiotics, that theory of preventing diarrhea or reducing diarrhea, bacterial vaginosis is that other sure thing that we know that probiotics will do. Now, there were some studies that have shown that uh, probiotics for infants help in colic. Well, colic is a gassy situation. It kind of makes sense that you would give the baby a probiotic and it would help. Um, there's more. And the crazy thing is there's all these different things, but they're all towards the gut. There's all these different things going on in the stomach that probiotics help for or help with. Constipation is another one. They've shown that probiotics are beneficial in adults, but not so much in children for constipation. And that could be just a thing about the way that our bodies are structured and their bodies are structured as they're growing. Um, but it has been shown to be beneficial in adults versus being beneficial in children for constipation. Um, of course, we talked about diarrhea. So not only just probiotic induced diarrhea, but just diarrhea in general. Because anytime there is diarrhea, that means that your gut health is diminished and the um, good bacteria and bad bacteria are off balance. So that's that one. H. pylori. Now, H. pylori is an actual bacteria-related ulcer, or it's a bacteria that causes an ulcer. So if you ever have an ulcer and they test you and it comes back positive for H. pylori, they give you these bunch of medicines to take for like 2 weeks straight. Probiotics actually can help with that, that timing of it all and help to restore the good stuff, because they're going to put you, for that particular one, they're going to put you on double antibiotics and a proton pump inhibitor or sometimes some other source. But for the most part, you would need a probiotic just to get you back into regular, stuff. Then this one surprised me. Hypercholesteremia, which essentially is high cholesterol. So it helps to improve lipid levels, which I was surprised about, but it does. So that's another reason to take your probiotics. This one I was not surprised about, but here we are, is IBS, or irritable bowel syndrome. So it is actually a recommendation by the American College of Gastroenterology that you take a probiotic if you are someone who has been diagnosed with IBS. So if you've been diagnosed with IBS, please take a probiotic. It is actually recommended that you take one to help you relieve some of the symptoms of the IBS. Remember, probiotics help to align the gut health. So another one is liver transplant. Not quite sure how it works in that, but it's been shown that it does have some help with those who have had liver transplant. Ear infection prevention in children. That's a good one. Radiation induced diarrhea helps with that as well. Respiratory tract infection prevention. Um, Rotaviral diarrhea, or the rotavirus. So it helps with the diarrhea that is associated with the rotavirus. And then ulcerative colitis, which that's to be expected as well, because ulcerative colitis is a disease state that causes diarrhea. So now that's a lot. Those are the ones that we know for sure that it works with. There are more things out there that they are trying to see if it helps for, but we don't quite know. There's not enough data, not enough sufficient data to go around and for those other things that they are trying to see if probiotics will help with. But I will say this: probiotics are a very good thing, a very natural thing. They are something that you could take on a daily basis and it's not going to hurt you. Um, leading up to adverse effects of that, of course, it's not going to hurt you. So it's generally well tolerated. If you do have any type of side effect, it will be mild GI upset or mild, stomach upset. But it wouldn't be severe because probiotics are actually there to help your gut and not hurt your gut. The dose that you would take on all these different probiotics that I just mentioned would definitely be according to the package that you're taking. So make sure that when you do get this probiotic, you're reading directions that's on the back of it. Make sure that you are taking it the way that that particular package is instructing you to do so, because there are so many different probiotics and they have so many different doses for them. I would always suggest to read the labels when it comes to that. Adverse effects, we talked about that already. Interactions with different types of conditions. Now, if you have a compromised gut integrity, that means if you have an overload of certain things going on in your gut, just kind of watch out for that. You want to make sure with that anytime you have some type of disease state that is involving the stomach, and you know that probiotics, that's where they work and live. Anytime you have some type of disease state that is involving the stomach, yes, we know that probiotics help for all of these things for the stomach, but you want to make sure that you are checking with your doctor to make sure that they don't see any reason for you to not take it. I always want you to check with your doctor, check with your pharmacist before you take any supplement, because you just don't know if it may have an ill effect based on you. We know what standard that's out there. We know what you're supposed to be taking, and what it's supposed to do, but each person is different. So make sure that you are taking the supplements according to physician and package directions, making sure your doctor knows that you are on this supplement. Now, the one thing that is left to say about probiotics is that if you have a yeast allergy, you can possibly, sorry, be allergic to some of the probiotics, because some of the probiotics have yeast in it. So if you have a yeast allergy, please make sure that you are not taking a probiotic that has yeast in it. Read your labels. And if you are allergic to anything in general, please read your labels. You never know what's going to be in those different types of bottles, where they're manufactured. They may not have peanuts in them, but they may have been manufactured with um, in a same place that they have peanuts. So there's some cross contamination that may happen. So please just make sure to read the bottles. Most of them should say where they're manufactured and if there's a possibility of some type of allergy that could happen, or allergic reaction that could happen just because of where it has been processed. Now, that is everything on probiotics. If you have any questions, please don't hesitate to reach out. You can message me on in my inbox, message me on IG. But please also take the time to follow me on all of my platforms. You can follow me on Instagram, TikTok, Facebook, even on Threads, and also go to my website at www.drravinpharmd.com, where you'll find a whole bunch of goodies there. In addition to that, please subscribe to my YouTube channel, because all of these videos are aired there. I think I'm going to start doing something a little extra in the future for my YouTube viewers, because those viewers are special to me. They take the time to actually go to YouTube and subscribe. So I appreciate it. And I appreciate you watching as well. So we're going to keep building. We're going to keep growing. We're going to keep doing everything that God has called us to do. And I thank you for being a whole part of this journey. I thank you for supporting me and purchasing merchandise, because it takes some effort and some finances to do this thing for y'all. So if you did not know it, it's graduation season. I have been seeing all of these beautiful pictures of graduates coming across my timeline, especially the Doctor of Pharmacy pictures that have been coming across. I love seeing when Xavier has another class that graduates, and we have another line of fabulous pharmacists coming into the field, preferably to change the field and grow it and um, do the things that we have been called to do in this field. Take care of our patients, get people healthier, and we'll just keep moving that way. So here's a book. If you know anybody who needs it, it's The Do's and Don'ts of Earning Your First Six Figures. That book can be found on my website. I would appreciate it if you would support. And also, there are some other books there as well. One is pretty much a coming of age story for me, The Girl Who Wore Her Heart on Her Back. If you don't know me, I have a scar on my back that's in the shape of a heart, and that actually is the picture that's on the book. And then also there's a journal there for pharmacists when they're feeling just a little burnt out, for them to express some emotions. So if you would do me a favor and check those out. I also have some merchandise on there. I have shirts and mugs and things like that. And if I could be of help in any way as far as counseling or reviewing your medications, please don't hesitate to reach out. I do charge a fee for extended medication reviews, but other than that, a 15-minute consultation is free. So with all of that being said, I want to thank you for tuning in, and I will catch you guys later. Not sure what the topic next week will be. However, um, I do have something else that's going on with my church. It's called Help Talk. I do it quarterly with them. So if you want to tune in to Truth Churches, that's Truth Church in Cleveland, and their Facebook page or their YouTube channel, you will see me live again at 7 o'clock on Wednesday night next week. And that's where I'm going to be talking about the skeletal system. So tune into that, because we have to look at that biblical aspect of what God is doing in our body as well. And if you want to see me in Cleveland, we have the Emotional Me conference coming up next weekend on Saturday. You can register on Eventbrite. I think it's emotionalme.eventbrite.com if I'm not mistaken, but I'll drop that link in the comments after this goes off, so you guys can actually come out and let's talk about emotional intelligence. I'm one of the people that's on the panel, is led by our host, Apostle Kirkland Cross Jr. It's going to be an amazing time learning about our emotional intelligence and what that looks like from a medicinal standpoint, from therapy standpoint. We're going to have panelists there that will talk about all the different aspects and even some of the things that they've been through. So I think it's going to be an amazing time. I can't wait to serve the community in that capacity. And I am excited for what God's going to do on that day. And I pray that you'll be able to attend us. So go ahead and register for that. I will be there next Saturday. That's on the 17th from 10 to 4 p.m. And guess what? We feed y'all too, y'all. So come on out and join us and have a good time with us. And you talk about some of these things that we need to talk about in this community. So with that being said, I'm going to go. Hope y'all have an amazing, wonderful Wednesday. And I will see y'all later. All